Hello, my name is Lindsay Dalton. I am a functional medicine and integrative pharmacist and health coach. Today, I want to talk about this shift that we're seeing in healthcare currently. We're really seeing this shift from this conventional medicine model that has been practiced for many, many years, decades, into this more lifestyle based root cause functional medicine model. And I want to go over with you what the old system looked like, the new system we're getting into, the benefits of this new system, and show you some examples of how certain conditions are treated in each one. So let's get started. Right now, the approach that we take to chronic conditions in our conventional medicine model is sort of like band-aiding the symptoms, just putting a band-aid over what is going wrong. So this model of medicine that we use, it started out many years ago before a lot of drugs were even available. Women were dying in childbirth a lot of times because they would get infections. They would have complications during childbirth, have infections, and then they would get sepsis and they would die because they didn't have antibiotics. So finally, when penicillin was invented, or someone just, discovered it, these women started living. So they noticed that these women were overrun with bacteria. They gave them the penicillin. The penicillin wiped out the bacteria and it saved their lives. So it is absolutely fantastic in acute care, acute critical situations where something super bad has happened. We need to get a quick fix and then just move on. So antibiotics, great for this, right? But when we're thinking chronic conditions, there is not one singular cause to chronic conditions that we can just take a pill, wipe out the cause, and fix. Chronic conditions are what I refer to as lifestyle-borne conditions. So we live a certain lifestyle which causes dis-ease in our bodies. It's kind of, our lifestyle works against the way our bodies want to work. And because of that, our bodies try to compensate for that, and then they end up having some sort of dysfunction in the body. So, for example, high blood pressure. We're eating a ton of sugar and it's making our blood sugar, super high. All that sugar in our system is causing oxidative damage to our arteries, which our arteries then get a little hardened and they can't relax as well. And so that causes hypertension, high blood pressure. So you can't really take a pill to fix this hardening of the arteries, right? The pill that we're taking when we have high blood pressure is just going to bring down the blood pressure. It's not fixing the cause to why the blood pressure went high in the first place. So I hope that kind of illustrates for you what I mean by band-aiding the symptom. So what we're getting into now is more of that functional medicine, lifestyle, root cause medicine. Doctors, functional medicine practitioners are doing the hard work to discover what that root cause is. Is it nutrient deficiencies? Is it toxicity? Is it busted digestion? Is it hormone problems, thyroid problems, adrenal issues? It takes a lot of extra work to find the cause or the causes of the dysfunction in the body, but it is truly the way to heal the body. Instead of just throwing medications at people and masking their symptoms, we're working with the body. Our bodies are meant to heal themselves. And this type of medicine is just supporting the body's own healing mechanisms, right? I mean, doesn't that sound like such a better way to do it? I saw this meme the other day, and it was this doctor and this patient, and the doctor says, "Oh, yes, you have this condition that was caused by your lifestyle choices." And she goes, "Oh, man, does that mean I'm going to have to change my lifestyle?" And the doctor says, "Nope, here's a pill that's just going to take the symptoms away." And that's literally how we are treating chronic conditions right now. And it's absolutely maddening because it is just, there is a better way. There's totally a better way. And it's functional medicine. It's changing your lifestyle. Some people think functional medicine and they think, oh my gosh, there's going to be this huge price tag. It's not covered by my insurance. But you can get a lot of benefits from functional medicine and not run a single lab. Just by making lifestyle changes, just by supplementing certain vital nutrients that we're not getting in our food these days because our soil is depleted of nutrients. It just takes a little extra work, a little extra digging, but it's so worth it to know that your body is healing, and you're not going to be just covering up symptoms. You're going to be healing your body so the symptoms just disappear. Okay. So let's take headaches, for example. Let's say you have migraines and you go to your doctor. "Hey, I have migraines. Okay, here's this medication. When you get a migraine, take this medication and it's going to take the pain away." Okay. But what caused the migraine in the first place? Why am I having migraines? Why do I have headaches? There are a few causes of headaches. And I mean, there's probably way more that I'm going to tell you, but some of the common ones are super simple. Maybe you have high blood pressure and that's causing you to have headaches. Maybe you're just deficient in magnesium. Magnesium is crucial to helping the blood vessels relax. And if they can't do that, you can have headaches. You could have some kind of food sensitivity or intolerance, and every time you eat that food, that causes you to have headaches. Or it could be some kind of toxicity as well. There's so many root causes of just a simple headache. And I mean, wouldn't you rather just not have headaches than just having to rely on a medication every time you get one? I know I would. Hypertension, I already mentioned, a lot of times is caused by high blood sugar. So many people have insulin resistance and prediabetes, and their doctors don't tell them. Doctors wait until your blood sugar gets at a certain level for your fasting blood glucose before they say anything. But over the years, you can see it creep up, creep up, creep up. Your doctor's saying, well, it's still under that threshold, so there's nothing wrong. But you see that trend of it rising. You have to look at the trend. If it's rising every single year, something is wrong. Your body is working harder to keep that blood sugar level down, but your body is becoming resistant to the insulin, which is why it's creeping up. So this high blood sugar in your body causes oxidative damage to your blood vessels, like I had mentioned, and it can cause hypertension. Magnesium, lack of magnesium, again, can cause hypertension. Heavy metal toxicity can cause hypertension. There's so many different things. Fatigue. Everyone says they're tired these days, right? And even I have gone to my doctor worried about my level of fatigue. And he ran the standard conventional medicine thyroid lab workup and said I was completely fine. Did I feel completely fine? Did that make me feel better? Absolutely not, because I felt terrible. I could barely keep my eyes open 2 hours after I woke up. But digging a little deeper and doing some more thorough lab work, realized that I had what you call subclinical hypothyroidism. So even though my labs were normal in the conventional medicine lab workup, they weren't optimal. They weren't what our bodies really need to thrive. So you can have subclinical hypothyroidism. You can have problems with your adrenals, your adrenal hormones, your cortisol. So many things. Oh, stress. Stress and mindset can really cause fatigue. Just that mental chatter we have going on all day, every day is a huge driver for fatigue. Sleep, not getting enough sleep. It's obvious, but most of us don't get enough sleep. And there's so much that goes into getting a good night's sleep too. Eczema, when you go to the doctor or your dermatologist and you say, hey, I've got this crazy like itchy red patch on my body somewhere, what are they going to do? They're going to give you a steroid cream. All that steroid cream is going to do is going to calm that inflammation on your skin. Our skin is a reflection of what is going on inside our bodies. If you've heard my story, you know I dealt with terrible eczema on my hand for about a year. And it wasn't until I did a food sensitivity test and eliminated the foods that I was sensitive to, literally within months, my eczema was gone. Absolutely gone. No sign of it. I never thought my hand would ever look normal ever again. And just by eliminating certain foods, the eczema 100% cleared up. It's mind-boggling. And you don't know the impact of this type of care, this type of healthcare, this way of practicing medicine. You don't understand it until you've been a part of it, or you hear someone else's story, or you witness someone else going through it. It's absolutely magical, and it's the way we should be practicing medicine when it comes to chronic health conditions and the care of those conditions. So if you find yourself identifying with one of these conditions or curious about functional medicine, reach out to me. Go to my website, send me an email. If you live in Ohio, I can help you. I practice functional medicine in Ohio. If you don't, I am a part of a larger team with practitioners across the country who can help you if you live in their state. Reach out, because this type of medication is the future of our healthcare when it comes to chronic health conditions. Ooh, I talked so fast because I'm so passionate about this topic, but I really hope that it resonated with you. If you know someone who needs to hear about functional medicine, please share this video with them. I want to spread this message to everyone who needs it. I hope you guys have a great day.